Like what? What are we gonna do?
You gotta hit that go live button.
Yeah, the go live
Do
button for
it.
Instagram.
Oh my
Well,
God, hurry up.
that's not how this works. It
Why
takes
isn't
a
it
second.
working?
Every single time.
Oh, technology.
This is
Technologic.
this is the same thing that happens every time. See? There.
Oh
It
my
has to catch
gosh.
up.
Is that a Starlink thing, or is that
No, that's been
a
from day one
restream thing?
why you were like, hey, why is it never work when I do it? And why does it work when you do it?
Hey, we figured it out.
See, the thing is, like, you're like, hey, why doesn't it ever do it when I click it? And I go, wait a second. But you're impatient because it has to link the one thing to the other. And so then when I click it, it just looks like magic.
Again, is that like an Elon Musk slow
No,
Starlink thing?
no.
Or is that like a technology still just so painfully slow in 2025?
It's
It can't be me.
it's
No
just
way.
you're so jaded.
No way.
Like it's linking platforms and live broadcasting between platforms. It has a lag.
I already had to grow up with the slow internet modem.
Yeah, but apparently you forgot what that's like
and
because you have no
today
patience.
I need
No, the lag is 8 seconds. But that's the latency period is about 8 seconds.
Fortunately for the both of us,
latency. That's the name of that. Latency.
And the world,
Mm-hmm.
I've been engaging in more self-care to help me chill out.
I love that for us.
The funny thing about prevention is that if you weren't doing the stuff, the prevention stuff, what you're experiencing could be so much worse.
Yes.
And the thing about prevention is that everyone's complaint is like, well, either everything's totally fine, so why did we have to do that? Because the prevention made it fine. Or everything's still shit, and so the prevention was useless. But then you don't know how much worse it could have been if you didn't engage in these prevention practices or strategies.
That's why I call therapy a nonlinear equation.
Okay.
You want causality. You want there to be no problems because you do this thing over here. That doesn't work.
Mm-hmm.
So you do this thing over here, and whatever problem that normally would have come up spikes or hits differently than it normally would because you did something differently over here. You can't know that how you'd react because you did it or you didn't do it. So either you either did or didn't do it, and then you experience this thing, and then your response is how you ever did or didn't do it. It's kind of like Schrodinger's cat, if you know what that is.
Mm-hmm.
Where the cat is in the box and it's alive or dead. So like the quantum mechanics of therapy say, do the things over here, and over here you'll have a better result than if you didn't, but it still might not be good because like shit still happens.
Yeah.
Like it doesn't mean that your life gets better with the things don't happen to you in life. It just means, or even that your life gets better. It's how you process your life that may be easier, healthier.
Just imagine if you didn't do all the stuff that's good for you, how worse off you'd be.
Yeah.
And it's funny that people have that response and that attitude toward mental health therapy and then like self-care or wellness practices.
Well,
because you don't see that same reaction to like brushing your teeth.
Well,
you're like, well, I brush my teeth every day, and yet I don't have cavities. Why do I have to keep on brushing my teeth?
Well, no, but then they're pissed when they do.
Or I still have a cavity. What's the point? It's like a lose-lose situation.
Yeah, exactly. So like, and then it's like the whole karmic thing, like karmic universality, where it's like there's some karmic debt. So like, if you do something good, it doesn't mean good things will happen to you. It means that you did something good, and maybe that helped somebody or assisted somebody, but it doesn't necessarily come back to you. There's no like universal equation.
I wish all of those fallacies were true.
Yeah.
That would be lovely.
Like you're an amazing human being. I'd love for you to like, you deserve to like win the jackpot of like the lottery. And yet like, I know, but number one, you wouldn't play. Number two, like that's not how that works.
You wish for all of my hopes and dreams to come true.
Yeah. but also
because I'm a good person and good at what I do.
Yeah.
But that's not what it takes. It takes takes who you know.
It's a series.
Takes money.
Yeah, it's a series of
marketing,
seemingly small decisions that
publicity.
are definitively out of your control.
Yeah. And some people are born into situations that help them advance, or marry into situations that help them advance.
Oh, you poor thing. You married into a situation.
I wouldn't have done it any differently.
I offer you nothing.
I wouldn't. And I've talked to my sorority sisters about this too, because they've asked, because I was single for so long. I'm like, my goal isn't to get married. Like, if I meet someone who's awesome, and then we choose to get married, that's just like an extra bonus, but that's not like that's not the goal.
Mm-hmm.
And so my marriage to you is not something that I like needed to happen in my life, but I'm glad it did.
Thanks.
And our wedding was like an extra bonus.
Yeah.
Awesome.
Yes.
For us and everyone who attended.
And everyone who attended who still talks about it. That was a good wedding. Anyway.
So my self-care has been up. I think yours has been too, since you've been like tagging along with me.
No, it's not about you. I did the stuff for me. It was great.
I asked you to. I've been wanting to surf since, I don't know.
Since this is what you're talking about, yes. That I'm just like tagging along.
Yeah. Well, thank you. Thank you for joining
me because I was intimidated. And then you asked me to get in the water and you asked me to surf with you.
And then you also went to Muay Thai with me.
Yeah, but sure.
I would say your independent self-care has been D&D.
It's been some D&D, but it's also been like, I'm exercising more. I'm outside a whole lot more. I'm building a bunch of different stuff. I've built tons of things recently.
Who inspires you to do that?
Inspires me to do it? No, you ask me to do it. And then I have to find my own inspiration to then like make it.
Yeah.
Yes.
I help.
You do help make it. But you're the one who puts the pressure.
I'm glad you are including including my honey-do list into your self-care category.
That's not what I said. I said I like the creativity of building things, and that's been good.
That I've been adding to your...
The list makes me exhausted and a little tired and stuff.
And especially as a therapist in 2025.
Are you right that the things that you put on that list need to happen?
Self-care and good times.
Yes, but let's be very clear. The things on that list do need to happen. I do agree to that.
Yeah, that's true.
Yeah. So it's not like you're wrong.
And they're fun. I try to keep them fun.
Yes.
Fun DIY projects.
Yes.
that we show everyone on our Luna de Honey retreat social media pages.
Yeah.
So go visit there if you want to see how we put mental health integrated into DIYing.
Mm-hmm. It's actually pretty important. So
it's very empowering to be able to
make your space yours.
Keep on learning new skills, especially hands-on stuff.
There's a reason why they call it
and like do it yourself.
Like it's a reason why that whole institution apartment therapy became a thing. I mean, it makes sense. Like you gotta have space that allows you to feel
your environmental wellness. We're not talking about that today.
Yeah.
Today we're talking all about therapists.
I call them therapyisms.
Okay.
Moments where a therapist either says something great or awful, and they go either way. So on therapy or trash.
We're looking through all of the social media posts that have to do with therapy.
Yeah. Yeah.
So some of the videos we have for you today are from therapists.
Yes. Some are from therapists. Some
Is
are
what
not.
They're saying actually therapeutic and healing and helpful, or are therapists just talking some nonsense trash? That's not helpful and damaging.
And then we're also going to share other people's experiences where their interpretations of their therapeutic comments. Is it therapy or is it trash?
Is it trash?
Now remember, those are the therapists cannot defend themselves.
I know
of these allegations or accusations of this ridiculous statements, but
I feel bad for psych hospitals and for private practices and mental health institutions and their Google reviews, because you don't know, they can't defend themselves. No. You can't say like, yeah, well, I did treat you, and
you can't say anything.
This is what really happened. You can't disclose that information. Yeah. But then our clients, our patients, or consumers in care, they could just go and blast all kinds of.
Yep. And I mean, there are people who have gotten back to me and misinterpreted what I've said and
There's
took
that
it in a
too,
certain
yeah.
way. And they've emailed me and we've gone back and forth. And sometimes they've left care, sometimes they haven't. It's okay. Like either way, like that's fine. I've taken feedback from what they were saying. I didn't always have the controls to agree with it. Like there are certain aspects of like care that you can't help.
Yeah.
You know what I mean? Like if I'm running late, I'm gonna run late. Like whether you're in person or virtual,
We definitely try not to.
I try not to,
because we're
but
professionals.
I also give
And I
them the
hate
same
waiting.
latitude and same time and care.
Yeah.
So like it's not like I'm taking it away from you and giving it away to somebody else. It's
So
more like, yeah,
is like
that's one something else. Yeah,
does a perfect therapist or perfect anybody exist?
no.
Are there lines that can be crossed?
Yes.
Yeah, especially with like ethics. And then are there just like preferences or even like personality or even the stuff that someone's working
Like
through flares out in the therapeutic
fit.
relationship?
It's gotta be a good fit.
Ideally a good fit. And even under the best circumstances with a good fit, based on what you're working on, conflict can arise.
Mhm. And
you know, or disagreements.
yeah.
And the part of therapy is to actually work through that if and when something like that does come up for you and with your therapist. So, are there complaints about us somewhere out there in the world?
Probably.
Publicly, you
No,
think?
not publicly.
Probably not
They've
publicly.
addressed with me like directly, and they
Yeah.
may not have like liked me after, but at least like I addressed what they were saying and try to honor what they were saying there, even if I agreed or disagree. It's irrelevant. It's
Yeah.
their experience. So I don't know. Like
Yeah.
I hope the people who did not vibe with me and kind of went off to do their own thing.
Mhm.
Number one, understood after they contacted me, like I tried to validate that thing. Number two, I hope we found a therapist that fit. Because
Yeah.
they usually even do a follow-up going, hey, this didn't fit. What would fit? Let's find somebody who fits.
Yeah.
And what do we find? What do you not like about me? And it's a really weird conversation to have with people. But when they take me up on it, it's great because I'm like, what don't you like about me? And then that's weird. I will not cry about this. I'm perfectly fine. And they're like,
Yeah.
well, I don't like this and I don't like that. And I don't like this. I'm like, great. I think this person would be a better fit then.
Okay.
And that's what I do usually because
Yeah.
I'm like, hey, like.
And sometimes you could work through it and you're like, okay, cool, no problem. I'll just like adjust this thing. Like we won't do for if it's CBT, like we won't do homework because you're, have all kinds of stuff going on. Yeah. Or if you want more time to process, or if you want more feedback, or you need someone who's more direct, there are things that we could tweak in our work with people. And then some people just, want a different personality, different person, different,
that's okay.
different demographic,
sure.
And that's all fine too. I think whenever there was like conflict in any of my working relationships, that there was like an ethical issue that was coming up.
Yeah.
And then I had to set like a boundary, like, no, I can't do that.
Yeah.
Because of this.
Fair.
And then there would be like an explanation as to why. Or when I was working with kids and there was like abuse involved and then the parents got mad because I had to.
Sure.
We have reporting.
Yeah.
Stuff. It's all like either legal or ethical stuff.
Sure.
And then if there's personality differences, then we always say like it's totally fine if you want to meet with somebody else. We have some recommendations. I like sending people off to psychologytoday.com. There's your first resource.
That one's pretty good.
It seemed like you dazed out right there for a second.
No, I'm trying to think of like there's some great resources like Psychology Today is there. I feel like there's a lot of people out there who are looking for the simple solution. And I was getting a haircut today, and there was an ad for BetterHelp, and it really bothered me. And I was wondering, and I was still processing that when you were saying that. Sorry.
Yeah.
So like, because I still have a lot of problems with like what all the different aspects of what the provider. And that's just an example. There's a lot of out there that is like tech based, but it's not based on care. And so Psychology Today, I like. Because they have those things. Therapy Den sometimes does some great stuff. Open Path Collective, you can find those around everywhere for people who are looking for low or no cost therapy. Open Path Collective, great therapists on there.
We'll have all these links in our show notes. So this is our live stream recording of our DC radio show, Wit and Reason, with
Alex
and Dr. Alexis. And we do these live stream recordings every Tuesday night, 6 p.m. Pacific, 9 p.m. East Coast. And immediately. You could find it on demand on our YouTube channel at Wit and Reason.
Like now.
Like, well, it's live
so
now,
close
but
to
then
now.
even as soon as we click the button that
When
says
will then be
no
now?
longer live, then you get on demand immediately. It's obviously still raw and unedited with some profanity. And then I go back, the producers and I go back and edit and perfect it as much as possible. And then it's broadcasted on DC radio. And then our archive shows are on podcast versions.
Yeah.
And then you could also find all of this information on our website, witandreason.com/DC radio. So I say all that to say that everything you're saying right here as far as resources will include in our show notes for our description on our YouTube on demand episode for this one. And then it'll also be on witandreason.com/DC radio.
Okay.
So you will have access to everything that Alex is recommending here, because those are some really good tips.
I think they're good. And if you have other ones that you really liked, wonderful, fantastic. We'll
add in the comments. Please engage with us.
Yeah.
Please feel free to engage with us.
Yeah.
And add in the comments what resources you like to finding a good therapist.
Yeah, if there's stuff that we've missed, I know there's like goodtherapy.org, Therapy Den. Some people use things like ZocDoc, but I don't know. I don't know if people have found that effective. It's kind of like asking people their preference in dating apps, you know?
What?
Right?
What?
Think about it.
No, it's not.
Yeah, it's like, hey, where'd you find your person?
Really?
Yeah.
I don't think it's that. I don't think it.
I mean, we're giving a bunch of like examples of places to go find therapists, right? All these websites to match you.
Swiping through.
I know.
Except for, I don't know, like BetterHelp or something.
Yeah, that'd be no. The BetterHelp, you don't get any choices whatsoever.
It just automatically.
Well, we could
do a whole show.
I'm not doing it.
Yeah.
Doing it. Right.
So let's dive into to what people are saying online, either from therapists or about their therapists, and let's talk about whether or not what they're sharing is therapy or trash.
Fair. All right. I'm thinking this one. Start with this one.
Yeah.
All right. Let's dive right in, and we're going to share this thing right there. Share it. And why does it never let me do that? There we go. And play.
So therapists are in group chats arguing if it's ethical to accept a cup of coffee from their clients. Meanwhile, the president of the United States is accepting a $400 million plane.
That's right.
Oh, this is where we're going. Yeah.
Jesus.
This is.
Do you remember when that was a thing?
Yeah.
There's been so much news in 2025.
Oh my God.
It's like, do you remember the time when did he ever accept the plane?
Yeah.
How much was it again?
400 million.
400 million?
Yeah.
Okay, so this goes beyond therapy. Like, even just our friends who work in and for the government.
Yeah, you can't accept.
You can't accept anything.
But let's make it about.
If you do, you have to report it.
Right, let's make it about therapy.
Even in therapy, we have whole classes and discussions around this while we're in school. And then, as you heard from this was a therapist?
Yeah.
From this therapist, we have to say their name and everything. We also heard from this therapist that, yes, there are even private like Facebook groups or professional groups.
Yeah, but it's mostly Facebook
discussion
groups,
boards, email. I hate those things.
We're not on Reddit.
Those email chains.
We're not on
No.
If you're on Reddit, I don't know.
That discuss a variety of ethical dilemmas and how to navigate them, including gift giving.
Yeah. And I think cup of coffee could be like even referred to as like, say, like a tip or something thereof. Like, but like, I mean, we can't do those things a lot of the time. And there's so many reasons why they talk about that dynamic and what happens there. There are clients who've bought me gifts before. They've and there's certain things that I could do and certain things that I couldn't.
Yeah.
I usually talk about intentionality, but
everything has to come with a conversation.
Yep. Everything. And then they laughed going, I knew you were going to have a conversation. So this is my thought process around this particular gift. Accept it now. And that made me laugh very, heartily.
And
It
it's
was great.
usually in times of transition, you know, when someone's like ending therapy or you're closing out your cases.
Yeah.
Even therapists are encouraged to like provide some kind of transitional object. You know, I did that with the kids when I was saying my goodbyes.
Play-Doh.
Even
little things of Play-Doh.
Yeah, or like a little plant, you know, for the teens.
The Play-Doh for the
and
adults.
then it's ideal if it has some kind of like meaning, you know, meaning behind it. When I was leaving the psych hospital, the gifts were we would even like discuss it because I was like a ritual that would happen.
This I give to you because this.
Well, it was always like food related because it was
funny.
a maximum security psychiatric hospital and they couldn't get good food. So as like part of their
this
process.
Candy bar is meaningful to me and reminds me of
really
you.
Sweet treats, and then we got to check in with health and their doctors and get everything clear. It's a whole process when it comes to gift giving or receiving.
Yeah.
And then for therapists receiving gifts, we cannot accept a $400 million plane.
Yeah, but the thing is,
or a car or anything. What's the number these days?
No.
Like and then there's even drama around like what would be allowed. And then typically if you're like in a private practice, especially if there's like cultural considerations, like you don't want to be offensive, you still need to have a conversation about it. But if there was a reason to accept something very small, then you would say that you would be sharing it like with a staff or something. Or if it was like some kind of transitional.
I mean, and it totally depends on, and that's the thing, like, it depends on the context of the relationship. It depends on the person. It depends on what the gift is. It depends on every factor matters. And then if you're ever confused about that thing, you then think about it further. You seek consultation further. I mean, so some people are going to be 0, nothing, I'm going to do it. Other people are going to be like, hey, that's very sweet of you, very kind. And
I'm really curious about the circumstances that they were discussing online with coffee, because it's different if it's like a gift card versus like, here's a little cup of coffee. And then we come from forensics, like we can't consume anything or forensic patients. I
immediately went somewhere dark with that. Yeah, they're going to poison me. No. But in general, I think it's an interesting thing. The amount of ethics. I mean, I'm renewing CEUs, and I have to do 6 hours of ethics
continuing education.
Continuing education courses. I've been licensed for 20 years. I still need to do 6 hours of intensive ethical training. 20 years later, every 2 years.
Yeah.
I mean, like that's a lot of ethics training constantly. So
did they bring up the coffee?
No, I'm still gotta do. I did 3 hours of it already,
okay.
So we didn't talk about coffee.
So it depends.
Yeah, it depends.
But isn't that funny that even your therapist, let alone, I don't know, some other low level government. No offense to our low level government workers. They'll admit to that too, though. They're like, we can't accept anything.
We don't have friends that are low level. Yeah, I don't know. All right, let me.
Okay, who's up next?
This next
one.
And
then leave us in the comments too about if you've experienced any kind of gift receiving or exchange with your therapist, or how that went for you.
Okay, let me see.
Or if you want to give your therapist a gift, how to navigate that.
Not that one. This one.
Here we go.
Okay, this one is from.
We didn't see the last.
I can't see this person's
name. It'll be
name.
listed in our description.
GKD Talk.
We're gonna get better at this one day.
Yeah, well, I'll be able to see it one day. All right. Okay, let's see it. See what's going on here. Ready? I'm gonna share it. Whoop, that's not it. That's not sharing. This is sharing. Hey, edit me.
There. Just saw one of those videos where it's like, I'm bored, tell me this. And it was, tell me the most unhinged thing that a therapist has ever said to you. And I wanted to stitch the video, but it wouldn't let me. So I'm going to tell you 3 or 4 things that my therapist said to me that were clinically insane. All the same therapist, all the same session, and the first session with this woman. Okay, let's go. I already finished filming the video, but I forgot one thing, and it's the most insane one, so I need to put it first. I told her something that happened to me, and she said, word for word, I mean, that's okay. Not everyone's first time is going to be like rainbows and butterflies. I had been through a few therapists throughout my life off and on, so I got to this new woman and I was like, you know what, let me just unload. It usually takes me a while to like unleash my trauma, but let's just get right into it. I first started talking about my mystery neuro diagnosis that nobody knows what's going on. Long story. But I started crying, which is not really like me in a therapy session, but I was just so overwhelmed and I was like, I don't know what's gonna happen. I'm very scared. My scans are abnormal, but no one knows what it is. Okay. She looks me dead in the eye and she goes, why don't you just Google the best neurologist in America and just make an appointment?
This bitch.
I was like, well, it took me a year and a half to get my first appointment at my second hospital. So, and then she turns her swivel chair around, Googles best neurologist in America, and prints out the bio for a neurologist at Johns Hopkins and goes, just make an appointment with him. I'm sure he would love to talk about it since it's
How
so
that
like
works.
rare.
The fact that you don't know that just shows.
Hello? We moved on from that topic, thank God. And I started talking about my insecurities. And I was like, I've never said any of my insecurities out loud, but I'm just going to tell you what they are because it's really controlling my life and I feel very insecure. And usually I'm a confident person, but lately it's been affecting me. So I tell her what I'm insecure about my face. And to convey how insecure I am, I said, sometimes I wish I could just get like full facial reconstruction. She looks at me and goes, okay, why don't you just Google how much that surgery would be?
What? What?
What?
What?
I literally was like, okay.
Is this like the advice desk?
Thanks for that advice. And then she proceeds to say, I can't even say this. Oh my God.
Dude, you already got me in tears.
Listen, I know I'm not the prettiest person on earth either, but like you don't see me trying to get on the cover of magazines or anything, but I don't let it affect me.
The fuck?
I should have just stood up and walked out at that point, but I was like, clearly I have anxiety, so I can't do that.
I know.
The last thing I think that she said to me that was just insane was she circled back to the neuro topic and she was like, honestly, I think you're gonna be fine. You're like young and healthy, which everyone says to me, which I fucking hate.
Yeah, same.
She goes, you're young and healthy, and also you'd be surprised how much trauma the human brain can take. When I was going through my med school rotations and my clinicals and doing all my research and stuff to become a psychiatrist.
Oh, psychiatrist.
I saw a man that tried to in the head, and he survived. It was all about the angle.
No offense, good psychiatrists out there. Not assume psychological without ruling out medical. And you do not just dismiss people's very real health conditions or concerns. Oh. And then, okay, when they were talking about like the face reconstruction, I was like, ooh, is this therapist gonna like is this therapist gonna like overdiagnose or be or like jump to the conclusion that this is like some kind of body dysmorphia? And no, went the total opposite direction, total other direction of like, well, just go get your face done then.
Do it.
What if this is some kind of body dysmorphia shit and you're telling them to just go get plastic surgery? That's your you're supposed to be a fucking therapist, which they are not.
I mean, some psychiatrists do therapy, but it doesn't sound like this person knows how to do anything except maybe prescribe medication.
And that's the important distinction between psychologists, psychiatrists, clinicians, therapists, counselors.
So social worker, psychologist, licensed clinical social worker, psychologist. All right. Then there's marriage and family therapist.
There's a lot.
There's licensed professional counselors.
And then psychiatrists, their training is focused on medication. If they get any kind of clinical training or do any kind of clinical work, it's usually very brief and minimal. Whereas psychologists, even if you're PhD versus PsyD, dictates how much actual clinical therapy practice and training you have. So PhD, most of their time is focused on like research. They don't have as much clinical training because there's only so many hours in the day than PsyDs, psychology doctorates. Here's the trick though. We're all in the States, whether you're PhD or PsyD in clinical psychology, you meet all of the required standards based by the American Psychological Association. Some just have more research, some have more clinical training, but we all meet that same standard. Psychiatrists, what is their clinical training?
All right, so like, and you have to break down clinical training. So for psychiatrists, and anyone correct me, there's different rotations that you do as an MD, as you're kind of working on these things, even a DO, which is a little different. But you're working on your doctorate in medicine in some way, shape, or form, or a version of that. You then do a psychiatry rotation sometimes as a fellow, whatever else, and you go through and you work through medicine regarding mental health and issues. Now you learn how to diagnose various issues, and you learn kind of like what to look for and all the different psychiatric diagnoses.
So
you assess, and you also then
interview.
medicate, and that's through intervention and interviews. Also,
not testing though, right?
Some engage in a bit of therapy. They typically don't do testing. Some have done some testing,
and that's
depending
how
on the
psychologists
rotation.
confirm diagnosis is through testing.
So some
interviews, assessment.
Some know some of them, but not a lot of them. I mean, it just depends on, and not everybody has had the same training.
How many clinical hours, meaning how many therapy hours?
That's regulated somewhere in America, but I don't buy.
Do they have to do?
Is that like the AMA, American Medical Association, or maybe like the American Psychiatric Association?
And having worked at hospitals, I've worked alongside psychiatrists, and they try to do therapy. I've already had like many hours and years under my belt, and
I've worked with wonderful psychiatrists. I've also worked with psychiatrists who are really talented medication prescribers and understand all of the things around medication. I've also worked with ones that weren't great at either.
Yeah, I got them seared, and I have the conversations, the dumb conversations and questions seared in my memory. So but some good supervisors. I mean, maybe it's because they were just
so
in
know
training
who
and
you're
they were
talking
young,
to. Don't be surprised.
Is it all psychiatrists? No. When something bizarre happens, do people usually say it was with the psychiatrist? In my experience, yes. So all of that, before we go on, was trash. And I am so sorry. I'm.
That person seems so ready for therapy.
On behalf
of like a really excitable way. I would love that person as a client. Yes. That's like a perfect client.
And on behalf of all of mental health, I am so sorry that was your experience.
I'm so curious as to like whether they found
none of that should have ever happened.
I'm so curious.
And I hate it when stuff like that happens, because not only is it harmful to the person directly, but then also in that moment, but then also considering, their future mental health care and then who they talk to about therapy. And then hopefully everyone, we should go through the comment section of that one. Hopefully everyone gets that that's not every, that's not every psychiatrist, and definitely not every therapy experience.
Yeah.
There was just so much, everything was wrong.
Everything.
Even the first one, I didn't really understand that. Like they were like kind of like dismissing one of their experiences that they had. And
not everybody's first time was that great, or Sunshine and Roses or something like that.
What the fuck? Like, what? And report these people.
Yeah.
We'll put that information.
Yeah. Google
in our description as well, or like, or do a search on like, how do I report this clinician?
Not good stuff. That's trash. All right, so let's listen to that. All right, so kind of, I thought this one was interesting. Ready?
All right. Give me something more positive, please.
Well, I don't know about positive.
You cannot trauma dump to your therapist. That's not a thing. It is our job to hear about your trauma, and we are supposed to be there for you in these times.
I like that they made the distinction. That is
short and sweet.
Yes.
And it sounds like it's coming from a therapist.
Yes, it does. Now, I think what I really like about this is when you first hear it, I think you may think, okay, like you can't trauma dump to your therapist, meaning you shouldn't do that. No, it's saying that exercise, that's the whole point. The whole point of therapy is whatever you consider trauma, go for it. Your therapist will navigate you through whatever pathway you need to. Hopefully they have the skills to do those things, but you're not trauma dumping. You're just talking about what your experience is.
Yeah, it's like
Like, they're here for that.
It's like it's not physically, psychologically, or emotionally possible.
Yeah, it's like when clients are like, "Oh, well, that was a
trauma
lot.
dump on your therapist.
I just dumped a lot on you." I'm like, "No, you didn't. You just talked about your experience. That doesn't do something to like." I'm like, "Oh, I'm so tired of your life." Like,
No, we're trained professionals.
We're good. We're good. We love you. It's
please,
all right.
Please tell us
more.
Tell us everything.
Yeah.
As you know, no rush or pressure, but like, you know, as you're ready.
Yeah.
Tell your therapist everything.
Notice that I'll then ask follow-up questions about all of the everything.
Yeah. We want even more.
Yeah, we will continue to ask you that.
Yeah.
Yeah.
And look at it in every which way possible.
So no such thing as trauma dump. Let it go.
Let it out. This is your place. That's what therapy is for.
Yeah, let it go.
I like that one.
Yeah, it made me smile because I heard it. I was like, you can't trauma. Well, isn't that just what I was like, that was
a good hook.
Yeah, I was like, oh, that's clever. I like how.
Yeah, because you want to argue with it. Like, what do you mean you can't trauma dump on your therapist? Isn't that what we're paying you for? Yeah. Oh, well, they're saying
because
that,
it doesn't exist. That's what we do.
Not a thing.
I like it. All right, we got one more for you. So that was in our opinion, therapy, definitively therapeutic, wonderful. Love that. All right, so when you're seeing a new therapist, don't worry about the trauma dump. Say what you got to say.
Yeah.
All right, and last one to look at. I think I like this one. We'll see how this goes. Okay, ready and.
Alcoholics Anonymous and Narcotics Anonymous are both dangerous cults, okay? And the reason they're so dangerous is because they deny science and evidence, and they perpetuate pseudoscience and superstition within this cult religion. Now, the main thing I have an issue with is the fact that they are the main perpetrator when it comes to perpetuating the abstinence violation effect. Now, the abstinence violation effect is something that someone experiences after a period of abstinence. Many people are coerced and forced into abstinence and even mandated Alcoholics Anonymous or Narcotics Anonymous attendance. And after individuals have a period of forced abstinence, they're at increased risk of overdose. Okay, so that's important to notice, or note rather. And the other aspect to this is that the abstinence violation effect as a whole, it perpetuates this idea. So after a period of abstinence, whether it's coerced or mandated, someone consumes a substance, all right? And when they consume that substance, they have now violated their abstinence, okay? Because their value is being derived from the amount of time abstinent. Okay, and that's very dangerous to do, and that's why sober chips, key tags, obsessing with how many days it's been is super fucking dangerous, okay? But anyways, after that period of abstinence, they've now violated it. Now what happens? Psychologically, they experience a decline in mental health, shame, regret, and stigma that is then projected onto them. Now, they've also lost all of their time in their minds, and so now their perceived value that was coming from time abstinent is gone. And during that time, within 12-step, people have also embodied very negative labels and internalized views that are very harmful, limiting beliefs, self-fulfilling prophecies. So this is setting people up for far worse returns to use, or what most steppers call relapses. Excessive use, because they were told that they have a physical allergy. So once they use one thing or drink one thing, they have now lost the power of choice. And then the spiritual malady, the mental obsession, the two other aspects of the threefold disease, perpetuate shame and stigma as well, and this loss of control rhetoric and narrative. And so now someone uses excessively because they've lost their community unless they submit to getting a new, a new chip and starting over, a new key tag and starting over. So they've now lost their support. They've lost their identity and their value as a person abstinent in their minds, which they haven't actually lost it. And they are now going to use in isolation because that's what people do when they're ashamed. And then again, excessively because they're taught that that's what's going to happen because of the threefold disease. This is a crime against humanity. This is fucking terrible. And I'm so sorry that this is happening to people's family and friends, and it's happening to people. It's terrible. I'm a success story of Alcoholics Anonymous. Okay. So let's get that out there right now. I had a bad experience with medication-assisted treatment, but I support evidence-based medications. I support what works for people. 12-step does not work for the majority of people, and I cannot ethically advocate for it. If anyone's interested in this beautiful cafe right here, check it out. It's beautiful, very well made.
Okay.
All right.
Thoughts?
Okay.
Feelings?
Yeah.
Reactions?
All right. So I've worked in addiction for 15 years.
Yeah.
18 years.
Yeah.
So
your work in addiction's strong.
Yeah. So I used to run
stronger than mine, so I'm glad you.
So I used to run chemical dependency intensive outpatient programs.
Yeah.
I still do addiction
too.
work.
It's been a minute.
Yeah. So I used to do that for Kaiser. I used to do that for a lot of different people. It was
I
great.
did it for outpatient.
So all right. So I like aspects of what I like people to get some sort of aspect of treatment, and I like people to get some sort of version of support and community. AA and NA, I will always say, like any of those programs, any of the anonymous programs, I will always say not all groups are created equal. You should have people who have guidance, understanding, and mitigate and minimize any of the problems that this person was actually addressing, which are significantly accurate and real problems.
Yeah.
I do like that. There are people who need some aspect of conceptual letting go of, the control as a conception there, because most of the time, like the one day at a time, the focus on the present, all that stuff is really useful. And it's an interesting contradiction to see somebody go one day at a time, but also here's a chip for 90 days.
Right.
One day at a time. And so I do understand what they're talking about regarding that kind of reward-based thing, and that there's shame and guilt there regarding relapse and lapse. Now, if you're in a good group, your lapse or relapse regarding these things, return to use as he was using, is not shamed.
Yeah.
It is like, hey, what's up? We hear you. We see you. You've been doing the work. So glad you're back. So glad you're awesome. It's really supportive. Yeah. So if you're in a group that shames people for their lapses or relapses, it's not a good group. That's the cult aspect that it's kind of talking about.
That's that specific group of people that's not inherent in AA or NA.
The other thing that I really like that he talked about, abstinence. When people, like, you have the right to do any version of any of those things, seek some sort of counsel, so some sort of like therapist or someone to work with regarding these things. If you've had some sort of serious addiction where you're having withdrawal and everything else, make sure that you're doing that assisted, like you talked about, for you can do medication assisted work, anything else like that, but follow up with somebody who knows something about your medical history so that you're okay.
Yeah.
They'll do really well with that. You'll do really well with that. You work together, it'll be fantastic. Now, if you want to go abstinence, okay. If you don't want to do something like that, you want to do moderation, fine. Let's look at the core principles of why you're using and what that means to you. And can you then maintain those things over here and use responsibly and ethically in this dynamic without disrupting, destroying, and just tearing apart your life over there?
Right.
Can you do that? Not everybody can. That's why a lot of people do abstinence for a time and then move towards moderation, because at some point in time they go, wait, the thing that I really needed to work on was this. I worked on this. Now I can moderate effectively, and that's not the issue anymore. And that's fine. I don't have any problem with any version of any of these things. I do think that it is hard when you reward only the abstinence and you're getting people's opinions.
Yeah.
And remember, it's run by people who have graduated out of the program. So there's no professional opinion there.
And some people may have, taken certification courses.
But anecdotal evidence is not actual, like an experience is not, it's not real evidence.
Yeah.
It's not truth.
So there are benefits and limitations to peer support groups.
Which is what this is. It's not just a support group. It is a peer support group. So thank you for making that distinction.
And the same with even just someone who's specialized in like substance abuse, like counseling, and has a certificate. Their training and experience is limited in comparison to someone who has their master's degree or their doctorate.
Yeah.
And who's specialized in addiction treatment and recovery. And so with peer support groups, sometimes it's recommended, I would say maybe even a lot of the times it's recommended, because it is helpful to have people who have same lived experience and people who might be more readily available than your therapist or your doctor. And so I think the access to people with same lived experience
Mm-hmm.
from AA and these support groups, it is incredibly life-saving.
Yeah, no,
to people.
Well, because it's
in many
validating.
cases.
It's validating in a lot of ways because they're able to see and reflect back on people's experiences that are similar to them when they may feel ostracized or alone because within, say, their family group or friend group, they are now different because of their use. So those are all really useful tools.
Or leaving their former friend group to create, to create new friendships. And support systems.
There's one thing I'd like to really point out. There are non-religious AA groups. Mm-hmm. Like any anonymous group, there are non-religious versions of all of those. So just let's throw that out there. Like, you don't have to do the whole give it up to God thing.
Yeah.
There's one that's specific to science that I love, is amazing. It's like existentialism and universalism.
How would people find these groups?
You have to look them up specifically. A lot of them are online because that's an awesome place to be at this point. Yeah. But I mean, even if you looked at the 12 steps from that point of view, if you typed in alternative 12 steps, you're going to find a ton of different alternatives to 12-step programs. Additionally, there are other programs out there that are a little more evidence-based that could be really great. Some are not free. But they may also be smaller. Like, for example, it fell right out of my head.
We'll put it in the description, and you can find it on our show webpage, wittenreasons.com/DC radio.
It's one that's CBT oriented, and it is, I can't remember right now.
Yeah, and the thing is, ideally, you would have a treatment team, or support. Let it go.
Okay,
move on. Or support, because now you're totally distracting me from what I need to say to wrap this up. Explode. I already said. Oh, jeez. Done?
No. Yes. Okay. All right.
This is the stuff I get to edit out later.
Whatever.
But we'll be on YouTube for months until I get to it.
Watch me cough, people. Watch me cough.
Oh, shit. What was I saying? Oh, support systems.
Yes.
Treatment team. So ideally, you would have your therapist that you could be working with, your medical provider, checking with your body, making sure that you're physically healthy, therapist to help guide you in the right direction, kind of check in with you about how everything ever is going for you, and your peer support group.
Yeah.
And then, if needed or helpful, a sponsor. Someone that you could get a hold of where you may not be able to get a hold of your medical provider or your therapist.
Yep.
And then ideally your family, and then if you need a new circle of friends.
Favorite two things that you can pull from anything regarding AA, if you're going to pull only two things from any anonymous. Number one, reach out instead of going inward. So call a sponsor, that version of going out. Just going to a meeting, go out. Go outward instead of just going inward. Otherwise, you're going to feel really alone. You're in your head. You got nothing else but you. That's really hard to feel like you don't feel supported. So if you're going to learn one thing to do as an intervention, reach out, go in. The second thing is about control. So let go of the idea of that control, right? You have to let go of the idea that you can control everything, that everything will be perfect, or that you have this conception to change or alter the reality of fabric of the world. Things are going to happen. Life is going to happen. Grant you the serenity, because I like that thing. It's a version of radical acceptance.
Yeah.
So radical acceptance is really important there, and understanding that there's only so much you can control in this world, what you say and what you do, and everything else there. You know that that there is a modicum of not helplessness, but vulnerability, and that's okay to be vulnerable. That it won't all be perfect. So if you're going to pick up two things from any of the anonymous groups, those are my favorite two. And I love those. I believe in those. Those are good ones.
And feel them out. If it's too rigid or shaming, not even too. If it is too rigid. If it is shaming, that's a red flag.
Yeah.
If it has those aspects of a cult, red flags.
You could try a smart recovery meeting.
Did you just find the word?
Yeah, it's called Smart Recovery.
I don't even remember what that was in reference
That
to.
one's a really great alternative group that's CBT oriented, and that is led by actually like a trained person to lead the Smart Recovery groups, and they are worksheet oriented and a little bit of discussion about skills. So if you're looking for just skills, Smart Recovery, another good one. They're like $5 a meeting.
Excellent.
Yeah. Sorry,
No,
I
it's
got
good.
really excited about
So,
that.
final judgment on that post?
Therapeutic. I think it's too blanketed. I would say you're casting too hard of a net.
Too generalized.
Too generalized. There we go.
Which to me is dangerous. Because there are solid AA.
Yes.
NA
groups out there. Yeah.
That have been life-saving, that are and continue to be life-saving. And so we don't want to generalize all, and making a blanket statement like that's so fucking dangerous because you could be stigmatizing.
Well, you could be
in the fight against stigma, you could be stigmatizing
and then
an aspect of a person's treatment that can be beneficial and life-saving
and
to them.
It's also the most accessible. And so like that, I like really truly to the fact that everyone creates a space for that for people, any community-based spaces like that is great. So do not hesitate to go. If you're contemplating going, go. Now, if you don't love that meeting,
try
out a bunch of different ones. There's a bunch of different types of meetings too. You may not know this, but there's types of meetings. There's like a panel meeting where you just hear people talk. There are like the big book meetings where you're reading out of the book and discussing the aspects of the book, almost like it feels like Bible study. There are different types of meetings. Nobody talks about that before they go. They just show up and they're like, what is this? And that's why.
See, everything you're saying would be a much more helpful post, I think.
Thanks.
So that part was trash. The therapeutic, helpful part was talking about all the red flags to watch out for.
Yeah.
That would make it more like a cult.
They're good red flags.
And that would make it dangerous.
Yes.
So.
And especially if you just still it. Like down to like something like a little bit more, feeling a little bit more judgy and painful.
Yeah. So I appreciate the creator mentioning that part of it and being real about those experiences as well that some people have.
So I would say if you look at pieces of this, very therapeutic. If you look at the other pieces, just remember what the message is about, right? Like, I mean, you can't say everything is for everybody ever.
Yeah.
There's no time I ever give some people skills and say, oh yeah, this works for everyone. I can prescribe this to you because it works for everybody. No, there's things I like. And then if you tell me it sucks, I will say, awesome. Tell me why it sucks. And it is not to gaslight you into why you're wrong and give you something. So that's important. That's what therapy looks like.
All right. We'll see you next Tuesday. every Tuesday, 6 p.m. Pacific, 9 p.m. East Coast. We're live.
Eastern?
Yeah. Eastern. Yeah, that's right.
Yeah.
Eastern.
All right.
We're live recording our show. And then you could also catch us are on demand on our YouTube channel, youtube.com at Wit and Reason, WITANDREASON. And you could find all of our past shows at witandreason.com/DC radio. And we always love to offer you all access to the Aura Health app because I have some lessons on there, some meditations to help you chill out. Hopefully.
That's so good.
Helps you chill out. Even some sleep meditations as well.
The pink noise stuff.
It's
so good.
I'm not even interested.
It makes my brain work.
It does.
It's awesome.
I don't know.
Yeah.
I guess I'll try it one day.
Yeah.
So check out the Aura Health app if you want to guest pass, go ahead and check out that link. Link also in bio. And then please, whatever you find out there, send it our way.
Yes.
DM us or tag us in stuff that you find online. Either TikTok, Instagram, YouTube,
anywhere.
Facebook. We're not on the formerly known Twitter. We are on Blue Sky, but we don't use it. Let's be real. Do we have a Reddit? I don't know.
No, but I mean, I would Actually, maybe we do. We
Send
might
us
have
a
a
link.
Reddit.
DM us a link or something.
We might have a Reddit.
And so if you're like, wow, this is really awesome, and you think it's really therapeutic, send it our way so that way we could feature it on our show. Or if you're like, this is, I don't know, is this kind of questionable? Is this sus? Is this trash? I don't know. Send it to us and we'll let you know what our thoughts are on our entertaining and educational show.